Has someone you love been diagnosed with a mental illness? Are you confused about what you can do to help them? Then this podcast might help you. When someone you love has been diagnosed with depression or bipolar, you want to help them. But having said that, it is also crucial that you don't get drained or exhausted trying to help them. This podcast will help you get a good balance between when and how to help them and yet practicing self-care and making time for yourself to prevent burnout. Hello. Welcome to this podcast, which will be focusing on loving someone with a mental illness. I am Dr. Prerna Kohli, a clinical psychologist and the founder of MindTribe. At MindTribe, we provide affordable counseling, support groups, communities, workshops, and e-learning for improving your mental health. When a friend has a fever or even a stomach infection, we might take them to a doctor or give them some medicine and good food. And we know to a certain extent what we need to do to help them in any way we can. However, when it comes to a mental illness, it can be extremely challenging, especially if the person who has been diagnosed is a sibling or someone you live with. It will not only affect you as the caregiver, but it could also affect your relationship with the person. What you can do to help the person is subjective and depends upon the needs of the person and what condition the person has. How you would help someone with depression would be very different from someone with PTSD. But here are a few general things that you could do to help them. Educate yourself. The first step would be to do your research and educate yourself about what the illness is, the symptoms, and what treatment options there are for the person to be able to get better. This will help you get a better understanding of what it's really like for them to be struggling with the condition they have. You could also talk to maybe a friend who has gone through a similar experience. This will help you get a better idea of what your loved one is dealing with. It will also help you empathize with them better. It can help you be there for your loved one in a more meaningful way, providing emotional support and understanding. You may be able to ask more informed questions of mental health professionals and help your loved one navigate the healthcare system more effectively. Understand triggers. As important as it is to research and read up about other people's experiences with the same mental illness, it is important to understand the person your love's triggers and what might lead to an anxiety attack or a PTSD episode. A hypothetical scenario could be your best friend has probably been recently diagnosed with anxiety. You could talk to them and ask them about what they find triggering and what you could do if you were with them at that time of an anxiety attack. If they have an eating disorder, finishing a meal could be a lot harder than it seems. Thinking about food as a whole could trigger some negative emotions. They might have lost someone they love, then that could be the main trigger. Maybe if a conversation about losing a loved one comes up, it might be triggering and could lead to an anxiety attack or just feelings of anxiousness. You must understand their triggers, because then you could distract them or talk about something else when they have an anxiety attack. Be empathetic and validate their emotions. Imagine this. You know how when your brother or friend has an asthma attack, you don't dismiss their struggle by saying, "You're just being overdramatic." You understand that their condition is real and needs immediate attention. But when it comes to mental health, we often fall short of being sensitive and validating others' emotions. Just like with asthma, it's important to acknowledge the reality of someone's depressive episode or ADHD burnout. So, let's talk about how we can be there for our loved ones in those challenging moments. First and foremost, remaining calm and being a good listener is crucial. When they're venting or expressing how they feel, take the time to truly listen and show that you care. Let them know that their emotions are valid and that you're there to support them. Now, it's okay to admit when you need a breather. Sometimes, you might need a moment to process everything they're telling you. If that's the case, communicate with them openly and kindly. Just ask for a couple of minutes to gather your thoughts before you continue the conversation. Sometimes, even small acts of service can make a huge difference. If you're the significant other of someone who's struggling, consider doing something thoughtful for them. It could be as simple as doing the dishes or cooking their favorite meal. These acts of service show that you care and can provide a sense of comfort. During a depressive episode, even the smallest tasks can feel overwhelming. Doing laundry or getting out of bed can seem incredibly difficult. So, stepping in and helping out can truly lighten their load. Maybe you can make the bed for them or prepare breakfast to make their day a little easier and less stressful. Remember, the key is to be understanding, patient, and compassionate. By being there for your loved one and offering support in practical ways, you can make a positive impact on their mental health journey. Be patient. You know, loving someone with a mental illness can be tough. It's not always sunshine and rainbows. There will be days when you feel overwhelmed and emotionally drained. And you know what? That's completely normal. You're only human, after all. Sometimes, you might find yourself at a loss for what to do or say. Why? You might feel frustrated or helpless, seeing someone you deeply care about struggling. It's natural to feel upset or distant at times. But here's the thing, it's okay to feel that way. Loving someone with a mental illness is challenging, and it can take a toll on you. There will be moments when you want to do something fun or go out, but they might not be up for it. It can be frustrating, right? Like when you feel like grabbing lunch, but their social anxiety is acting up, and all they want to do is stay in bed. Or on a beautiful day, you're itching to go for a swim or a bike ride, but they just want to sleep. It can be tough not to take it personally. But here's the key, it's not about you. It's about giving them the time and space they need to heal and get better. If they want to be alone all day, they might just need some breathing room. It's hard, I won't lie. But being patient and understanding, and giving them the space to come around can make a huge difference. Remember, loving someone with a mental illness is one of the most compassionate things you can do as a human being. It's okay to feel exhausted, frustrated, or distant at times. Take care of yourself, too. And know that your support and understanding mean the world to them. Together, you can navigate this journey and come out stronger on the other side. Listening to the person. This technique varies depending on what illness the person has. However, when it comes to depression or anxiety, hearing the person out without actually saying anything or giving them advice can be very helpful. It's amazing how powerful it can be to hold space for someone to express themselves. For instance, if they're having a tough day due to anxiety, just being there to talk and listen can make a world of difference. Instead of sounding panicky or anxious, try to remain calm and composed. When you approach them with a sense of calmness, it creates an environment where they feel safe and more comfortable opening up to you about their thoughts and emotions. By containing what they have to say, you're showing them that their feelings are valid and that you're there to support them. It's about being present and genuinely listening, without feeling the need to fix everything or provide immediate solutions. Sometimes, all they need is a compassionate ear. Practice active listening and create a space where they can freely express themselves without judgment. Your calm and understanding presence can make a significant impact on their well-being and help them feel more supported in their journey towards healing. Self-care. Coming to the most important point. Self-care. It is to be there for them and help them, but it is indispensable that you check in with yourself before you help them. Being there for them and loving them can take a toll on your mental health as well. Here are some self-care techniques that you can use to prevent burnout or getting drained. Use mindfulness to try to avoid worrying about the future or obsessing over the past and to stay in the now. You can maintain your composure and focus by being mindful. Make sure you get 7 to 8 hours of sleep. Stress levels might rise as a result of sleep deprivation, making it harder to handle problems. Regular exercise is a fantastic method to lower stress and improve your mood. A little stroll might make you feel better. Don't be afraid to ask for help, friends, family members, or a mental health professional for help. A solid support system should be in place. If you ever feel like you need someone to talk to a mental health professional. It is important to remember that the journey of mental illness involves not only the person who is experiencing it but also the loved ones supporting them. Set boundaries. It's crucial to do so to give oneself space. If you don't take care of your own needs, you can't be there for someone else. Maybe you have had an exhausting day at work and you are so mentally drained for the day that you don't have the energy to hear this person out. In such cases, it is important to set boundaries and let them know that you will listen to them another day. As important as it is for you to listen to them or be there for them, you won't be able to do that if your mental health starts deteriorating too. Self-compassion is a virtue. Treat oneself with kindness and gentleness. Keep in mind that it's acceptable to struggle and that you're trying your best. Another way of making sure your mental health doesn't get affected and practicing self-love is by chanting affirmations to yourself. Some affirmations could be: I am strong and resilient. I am doing my best. I am practicing patience and understanding. I am setting boundaries. Make time for your favorite hobbies and pastimes. By participating in them, you'll feel happier and less stressed as a result of this. When you make time for an activity like running or dancing by yourself, it gives you some me time and also helps you recharge. Make sure you dedicate at least 3 or 4 times a week to any hobby or activity you like. To conclude, it is very important that you love them and be there for them through this journey. However, it is okay to set boundaries and draw a line if your mental health is getting affected. MindTribe offers excellent counseling services, and booking a session with an expert can help you vent or release whatever emotions you might have.